Okay. So I feel comfortable. Let's start the meeting, and if the mayor can make it, awesome. And if not, I know the mayor will be at tomorrow's meeting. So can we have a roll call vote to begin? Lori.
Laurie Garcia here.
Jonathan.
Jonathan Schmidt here.
Marissa.
Marissa Carreri here.
Maren.
Aaron Goldstein here.
Shannon.
Shannon Dunham here.
Cynthia Kwasinski here. Okay, so we have started this meeting. Welcome everybody. We are going to only allow a short public speak for this meeting because it is a work session. It's really important that we get a lot of stuff done, so I'm going to ask either wait until tomorrow, or we'll let a few people in for no more than 15 minutes. So is there someone who would like to speak today? And Maren, if you can just let people in as they go. All right, let me keep looking. And I don't see anybody right now. I'm looking. Okay.
I don't see any. I don't see any hands raised.
No, I do not either. Okay.
Kira,
So,
Kira has her
Kira,
hand
yep.
raised.
Thank you. Kira just raised her hand. Okay, Kira, can you?
Thank you. I couldn't find the button for a second, so that's why I threw up my thumb up as well. So my name is Kira Henninger. I'm the parent of 2 rising second graders, and I live on Maple Street. I'd like to address the remote learning plan proposed by Superintendent Leclerc. I believe it is in our best interest as a community to begin the school year fully remote, but even in the hybrid model, there are 3 days per week of remote learning. First, live Zooms are set at set times requiring attendance is highly problematic. As Dr. Leclerc has stated, we all need to be flexible, but I do not feel this is being flexible as a district. Families have a variety of issues they are facing, and expecting all students to log in at the same time is not realistic. Whether parents are working inside or outside the home, they will not be able to help their young children log in at a certain time, nor will they be able to supervise to help keep them engaged. It's not flexible, feasible, or equitable. It places working parents at a disadvantage. Please take this off the table. Second, the plan proposes that elementary age students are in screens either via live Zooms or engaged in computer-based learning programs for 4 hours per day. This is not developmentally appropriate, nor is it conducive to learning. While I agree that students will need to spend some time on the computer each day and connecting to their teacher is extremely important, there needs to be flexibility and multisensory approaches available for learning. I also believe whole class Zoom should be minimal as it becomes teacher talk and not enough student engagement and opportunities to respond, which is how children learn best. Smaller groups seemed much more successful in the spring. I'm also very concerned about our children having no access to PE, music, art, or library on the remote schedule. Lastly, there should be workshops planned for parents and students to teach them how to use the devices, hotspots, and educational programs that will be used. Having young children that did not use devices at home prior to March, it was a huge learning curve and created a lot of frustration and therefore lack of engagement in learning. I'm happy to hear there's a new technology integration teacher, and I hope that's part of what they will be focused on for the training. Thank you.
Thank you. Anybody else? 2 more raised their hand. Okay, so I see Trish and okay. Maren, do you want to let Trish? Okay. I'm just looking. Here's the mayor. Okay, welcome, Mayor.
Good afternoon.
Okay, Trish.
Hi. Good afternoon.
I'd like to thank the school committee for continuing these working sessions and weekly meetings for the foreseeable future. Please know that all your work and the transparent nature in which you've conducted it is so very much appreciated by my family and I and the community at large. I'm going to read from a prepared statement so I don't let my mouth outrun my brain. My name is Trish Heed, and I'm the parent of a rising 5th grader. I'm speaking to you today to make one last appeal for a return to school this fall in a full remote learning model. I feel with the right remote model, our students can have a robust, engaging academic year full of new learning opportunities. I know this model will put an extraordinary burden on some families and is not doable for all student populations, but I believe the group of students that has no choice to return to school in some fashion will be much better served and more safely served if the district can focus on a more manageable group of in-person students while the rest of the school is on the same schedule. Easthampton's COVID numbers are on the rise with a percent positivity of 1.77% reported on 7/29. We saw 9 positive tests in the last 14 days in Easthampton. That's the largest 2-week increase since May, according to the Massachusetts Department of Health published statistics. And as small as we'd like to think our city is, it will very quickly get a whole lot bigger when Williston students begin returning to school as early as August 12th from across the US and internationally. This virus is still as new as it is confounding, and a new study published in the Journal of American Medical Association Pediatrics says that children can be as potent transmitters of COVID-19 as adults, and in some cases carry an even larger viral load. This, after all, we've all been lulled into the false hope that the virus doesn't really affect younger children. I understand there appears to be pressure to return to the classroom, even if for just 2 days. The superintendent has asked, if not now, when? I would say when we're not in the middle of a pandemic that is showing no signs of losing steam. I would say when we have a vaccine, and I understand, as the mayor pointed out, as the superintendent, mayor, pointed out, it will not be foolproof. Although I can't imagine anyone in the school system arguing against the efficacy of any other vaccine. I would say when our teachers feel comfortable returning to the classroom. Who wants their child taught by a teacher who is being forced to be there, who is rightfully scared for their and their family's safety? And the gold standard, as Dr. LeClaire keeps referring to it, is just that, the highest standard we can reach, and sadly, that's not achievable now. I'm sorry if she and the school administration sees that as a failing on their part, but it's not up for debate that we can't return to in-person full-time schooling, the gold standard. And if we're all being honest, neither hybrid model comes even close to the gold standard. So it appears to be just for optics, for show. And is that a show we want admission to? I urge you to protect the most vulnerable you were elected to serve. A school year will not make or break our children. And I think to insinuate that is an insult to the resiliency of our kids. This unprecedented time has the ability to shape our children. And we have these conversations a lot in our house, especially with my teen. Being adaptable, doing things that are hard, and especially things that we may not especially like online school, will not break or permanently scar our child or our children. If approached with the right attitude, this has the opportunity to be a great life lesson, and that's what will stick with our kids, not that they didn't get to see their friends for a school year. In closing, I would rather we err on the side of caution than set in motion a situation that we cannot contain or control. Thank you.
Thank you. So I don't see any, Kira's hand is still up, but I think Kira's just not taking that hand down. And thank you. I don't see anybody else. I'll give it a minute. Please signal if you.
I'm seeing Jean with a hand up.
Yep, thank you. Okay, Jean?
Great, thank you, everybody. My name is Jean Libby. I am a parent of a student at Maple who will be in 1st grade. I live at 68 Oliver Street. I just wanted to reaffirm my commitment and interest in supporting the public school system. My family will be choosing a remote plan regardless of what the district chooses. And I feel it's extremely important that we center all the reopening discussions on implementation of a robust, well thought out, and inclusive online education. Remote education will be part of every student in the district's learning plan this year. There's no way around it. And I'm a little bit frustrated that it's taken so long to center this at part of our conversation. My concern is that without a creative and robust remote teaching plan, families in the district are currently searching for other options for schooling for their children. Other districts have already unveiled their plans. Charter schools are offering spaces to their remote options. Folks are hiring tutors and teachers and planning to homeschool. Easthampton parents are already planning their own remote education plans without the district's guidance. I urge the school committee and the mayor and the superintendent to emphasize the importance of families in Easthampton to remain enrolled in the district and give us a good reason to stay with strong leadership, well-informed remote plans, and an engaging curriculum so that we can continue to support our district. Thank you.
Thank you. Okay, I see Margaret. We have time for a couple more.
Okay. Thank you so much for taking the time to listen today. My name is Margaret Betts, and I am a teacher at Maple. I teach fourth grade, and I taught first grade for 11 years before that, always in this district. And I want to talk not even about myself, but about the teachers who are going to be teaching pre-K, K, and 1. I am most worried about those teachers because they are the ones who are at risk because of the mandatory mask requirement doesn't address them. And so having those teachers go into classrooms without students masked is frightening for them. And I care so much about them that I really do worry. Teachers should not have to put their lives on the line because we want children in schools or because remote learning is suboptimal. Maybe if this was a career where you knew going in you were at risk and you'd spent years training to be safe in pandemic conditions, I would feel differently, but we're not trained. The amount of anxiety that teachers will have working with students directly cannot be minimized. Trying to put myself in the position of those teachers who have to go in every day, one of which 2 years ago lost her husband and has 2 children and is afraid that she will be putting herself at risk of her children being orphans. I wish this weren't so scary for us. It is very frightening for many of us. I don't believe it's hypochondria. I believe that it's valid because it's a global pandemic. Thank you for listening.
Thank you. And then Casey Purcell.
Hi, everybody. Hi. I wasn't going to speak, but I'm here. I'm calling, I'm actually, this is personal. I'm going to bury my father-in-law tomorrow. And I wanted to speak because I think the idea that we all know that the gold standard is kids in schools. And right now we're making a lot of sacrifice. I remember back in March, we were told to stay home. That was the most altruistic thing to do, to take care of each other. And our numbers have gone down because I think the schools have been closed. And I'm speaking because, you know, my children said goodbye to their grandfather on FaceTime. And that is the reality. That's the reality. And I wouldn't want them to have to deal with that of a teacher or even a student or an administrator, someone that works with them in their school. I think it's an ask that we just don't need to do right now. And I think we can do things in a way to best serve education remotely. It's not going to be what it was, and we know that. And until we figure this out, I echo what everyone's saying. I think the reality is the reality, you know. And to have 8 more cases in Easthampton, I will be quarantining when I get home, but that's where we are right now. And the thought of having many people together in one building just seems unrealistic at this time. And being able to connect with you on video right now, you know, I can see you and I can feel your presence. And I think having that with our children rather than being masked up it makes a big difference, and it can be done remotely. So I just urge that, to start out, that you vote for remote learning, and then we focus on that, and we take care of those in our community that need to be taken care of to make it work for everyone. But I just think that, we are where we're at. Nobody wants this, but this is the reality. I don't want to risk anyone's life at all. So I just urge you to vote for remote learning to start. And I thank you all.
Casey, I know we're not supposed to say anything, but you and I have talked. We're with you.
Thank you.
Deepest condolences.
Thank you.
Anybody else? All right, I don't see anybody else. I'm gonna scroll through one more time, Maren, if you double check, and we will go on.
I don't know.
You see one more?
Nope. I think
Okay.
we're set.
All right, good. Okay, so let's start. Thank you. I'm gonna close public speak. And I think we should start with the survey results from parents. And then I know that a lot of us have a lot of ideas and a lot of things we want to cover and have people think about overnight so that we come with as clear a mind as we can tomorrow. So Dr. LeClaire, do you want to give us the parent survey first?
Sure. Cindy, if you're the organizer and you want to share your screen, give me the ability to share my screen. I could put the survey up, or do you just want me to talk about it?
No, it's
No.
set. You can
Okay.
share.
He's faster than I am.
Thank
Thank you,
you.
Maren.
Okay, let me get up one of my documents. All right, no, that's an email. No, hold on. Okay. Can everyone see that before I dive in? Yeah, okay. So you can see we had 813 respondents. Not surprising, most of the respondents, the largest group was in the pre-K through 4. We had 433 respondents. I'll just read you the numbers in case it's so tiny you can't see it well. 5th through 8th grade was 308, and 9 through 12 was 259. And so we asked people to kind of disperse where their children are, because people have children in multiple buildings, so that was pretty equal. And then we asked about the 2 different hybrid models. People voted, it was kind of close, but people voted more for option 1, which is students in school 2 days a week and remote 3 days a week. That's a model that people have probably heard about, because other districts are also looking at that as a hybrid option throughout the state. But I know even within our region, I think there are several school districts right around us that have a same hybrid model they're putting forward. And then we also kind of tried to dipstick around. I spoke a little bit the other day about some variation on the hybrid model, whether we want to have a shortened day where children leave with lunch, and that's the blue on the circle, and or a full day in school, and that would be the orange part of the circle. So for the people that were responding to this survey, they primarily wanted the full day, and I can understand that because of childcare issues. That's probably impacting a lot of the people that filled out the survey. If you had to make a decision today for the start of the school year for your children, you would choose, and 63% chose the hybrid option and 37% chose the remote option. And that's been pretty, it's been around 62, 63% since we put the survey out last week. Hasn't really shifted. And then we just had some other questions trying to dipstick a little bit more information about children. And then we asked if people were looking for a full-time option. That was a smaller percentage, trying to get at people that maybe had more essential workers and needed to get their children back in school full-time, that sort of thing. So I think that we had a very good survey turnout. I mean, we have 1,500 students in the family. In the district, we don't have 1,500 families, but we have 1,500 students. So to have 818 families respond to the survey, I think is pretty good. So I'll kind of leave that up there. I sent this information to the school committee members already, so I know that you have it on your computers. Any thoughts or questions or reactions to that?
Anybody?
Dr. LeClaire, I would like to say that you said 818 families responded, but we really don't know that because within the same family, 2 parents could have answered. And I know for a fact that some people did that.
That is true. Thank you, Laurie. That's a good point.
My only other thing is not all the numbers add up to the total responses. So we're looking at hybrids, 768 answered, but we're close. So any other comments about that before we look at some of the teacher stuff? Okay, I see the mayor, and then Mary.
Yes. So thank you, Allison, for putting out the survey, whatnot. What I'm wondering about those questions is how it correlates to the 6 public health metrics put out by the state. So if we were to, do we know for certainty that families were answering these questions? What was their assumption around where our transmission and infection rate was? And what the extrapolation would be when we pull students back into the class, but also introduce anywhere from 8 to 11,000 college students who will be living off campus, some in our city. So I can certainly understand, as a former working parent, I would want my child in school, and she was an only child, and the anecdotal evidence, or my choice would be to have, my daughter back in school full time, but not in the face of fluctuating health data. So, I'm trying to figure out how to put it in writing, and look forward to having a conversation with the Board of Health and yourself. But, we closed the schools down because of a public health crisis, a pandemic that we knew nothing about, and kept them closed for quite a time, and did not see any data showing us that we have a control or understanding of the pandemic. And I'm having a hard time jumping, never mind the plan. And I know planning has to happen about all the different, I understand what Desi wants, but from a public health I guess I feel very good that the schools shut down when they did in Easthampton, and I don't see any evidence that public health crisis has diminished that schools should reopen in person in Easthampton. Not ever, not never, but I just don't get it. And we have some huge questions with our physical plants that we don't have answered yet. So I think the work is great, but I don't see I don't see how we extrapolate it back to public health metrics, the 6th. We're at 2% now across the state with clusters popping up. And remember, our numbers didn't go lower because kids stayed in school, and we kept them lower and flattened the curve. A part of flattening the curve was keeping kids out of school. And I understand the grave impact on some families around not having kids in schools, and some of the, I mean, grave, but I would rather be very creative and do some outreach or learning, or I will leave that up to the experts, than have to bury a child or have another child say goodbye to a grandparent or parent or sibling or whoever. And I will say what I said back in March. If history looks back on my tenure as mayor and they say I overreacted during COVID-19, I feel very, very, very good about that. I have no problem. So that's my piece, and I'll tune out.
Thank you. Maren and then Lori.
I just wanted to acknowledge that there was some concerns about the survey that did go the way it went sent out. I think that, I don't know, Allison, if you want to speak to particularly the branching issue, that the last 2 questions did not show up unless you actually marked the remote choice. And so there definitely was some concerns. As far as I understand, you can speak to it, but as far as my understanding, it was not the intention from anybody who reviewed that. It was an accidental error in terms of how it was sent out, but maybe you just want to speak to that question and concern.
Sure. So I think that, Maren, you're the one that brought it to my attention that there was a branching on question 6 and 7. 7 was an optional question to ask, and so parents were not, it wasn't necessary that people fill it out, and it was really only for people that wanted to make a case for some type of full in-person schooling. So I think that if you were already choosing hybrid, you were choosing some form of in-person schooling. So I think that's probably okay if they didn't see that one. And number 6 was a question to kind of classify if your child was in a special population, which would have been nice information for us to have. And, you know, obviously, if we're in a hybrid situation, we would have captured those students anyhow. So you know, it would have been nice for people to see those questions, but I don't think it skewed the overall information that people wanted access to have an opportunity to respond to. But in future, and a bunch of people looked at it too, and none of us caught it. So I don't know, we'll have to have more people look at it next time before it goes out. So I do apologize that that went out with those 2 branching questions. To answer the mayor's question though, you know, she brings up a good point about health metrics. And, you know, I have we're talking at the city level with our city health agent and our board of health about what the metric is that we should use to identify kind of when we trigger an in-school or a closed school kind of decision, because there should be some agreed upon health metric. What I'm dismayed at, and I expressed to the Board of Health, is that it seems to be random between towns. And when I asked our health agent if there was a state metric, she said, no, they haven't been given any direction. And it's sad to know that, because so many communities have boards of health that don't even do this full time. So, you know, it's a shame. I did find out today that we will be getting state guidance on a health metric. The Superintendent's Association has asked the governor to intercede and provide state level metrics for us. So we are looking at the health metrics data. And to the mayor's point about students returning to the area, I think one safeguard that we've already put in place is delaying the start of school to the 14th. I mean, I have nieces that are heading back to college, and they're heading back early. So I would imagine if there's going to be a flare-up, it's probably going to be, you know, at the end of August, beginning of September. So hopefully we will know by September 14th about the impact that college students will have, or even Williston students, as someone mentioned, coming back into our region. And so we'll be monitoring that carefully, but we are looking at the health information all the time. And it is really just a moving target. And, you know, it's not a decision for me to make based on that health metrics. I'm relying on the Board of Health and Bree, our health agent, to assist me with that, because I don't think I have I don't think I have a clear understanding of what that data means.
So Mary, you wanted to respond. I want to be really careful today in just reminding us the purpose of this meeting. This meeting is a brainstorming session about what we know and what we don't know,
Right.
and what we want to think about. We are not going to be voting because we are not in front of the full school committee public. And so I just want to do a little quick reminder as we go through. I know I have a lot of things that I want to hash out with you guys, but it's just a quick reminder that we want to vote tomorrow. Today is brainstorming, troubleshooting, asking questions, and throwing out all our issues. Okay, Mayor,
So
and
just,
then Lori.
yeah, I will just say on the health metrics, any interceding factor from the governor or whatnot is helpful, but it will not be mandatory. I'm on the reopening, and what I'm encouraging everyone on this call to do is take it as an opportunity to innovate. By the Massachusetts Constitution, local schooling is the responsibility of the local education agency, and we need to use and leverage that power to the specific health directives in Easthampton. I think we all know that Boston, wherever best intended, has no idea what happens outside of Boston, and we are barely in the state of Massachusetts for them. And given the what has been put forth between our school district, let's leverage education, local control, but also local Board of Health. And the chair of Board of Health and myself will need to make a public, it will come down to us. I mean, I am sure the governor will give the Massachusetts superintendents some guidance as far as those health metrics, and they should have done it. The governor's team should have done that much sooner. But I really do feel that there is no health metric, public health metric right now that tells me I'm not opening City Hall. We're having this meeting on Zoom. Please, let's innovate and use our local control and the latitude we've been given by the state and federal government, along with the care and what we know about our public schools. Let's help ourselves. And let's really think out of the box. And then I promise I'm done.
No. That's what this session's for, Lori.
I just wanted to respond to something the mayor had said before, and also what Dr. Leclerc had said about the survey. We did just get one email. I'm sure other people were feeling the same way, that somebody had responded that they wanted a hybrid till they saw what happened in Georgia. And I think that that's just going to be the first of many stories. And having a survey and then people changing their mind, we just have to keep in mind that things are changing all the time. Thank you.
Okay, Lori, you had some thoughts. I have a list of things I want to throw out, but you had some thoughts. Marissa, in case you have to leave, Marissa, do you want to throw out your thoughts and questions first? Sorry to jump, Lori, but Marissa may have to go.
I'm good until 6. So if Lori's ready, I can wait. Thank you so much. I appreciate that comment.
Thank you.
Can you give me share screen? I'm used to being the teacher. I'm not used to asking for that. So
Maren, you want to do that magic again?
It should already be set up for multiple users, so you should be able to do it.
Okay.
Or I looked and I wasn't able to. So let me see. One sec.
It's coming.
Okay. Can everyone see that already?
Yep.
Okay, let me get it on. Let me. Okay, I'd like to say that since March, we have all seen a major disruption to the education of our children in the wake of this deadly pandemic. As a school committee member, I've done everything possible to learn about the needs of my constituents by attending forums or watching them if I could not be on the live Zooms, reading and answering emails and phone calls, and keeping up to date with health metrics and anecdotes across this country and the globe. Facebook groups also provide a wealth of information, which can be very enlightening if you weed out the nonsense. I was fortunate to join a recently formed group of educators who are also school committee members from across the state. We are a select group with 22 members, but we are able to clearly understand what we are all facing, just as Cindy and I do, because we're both teachers. So you can see I'm saying educating all of our students in Easthampton public schools. And Williston is brought up a lot, but I know they are doing a lot of things to make sure the students coming back are kept in quarantine, and there are a lot of measures. So I want to focus on our students in the public schools.
Okay, Lori, I just want to make sure this is not heading towards your vote, right?
No.
This is, okay. You're just brainstorming ideas.
Yes, okay. So this is what we must avoid. We must avoid the spread of COVID-19. And I already mentioned what happened in the camp in Georgia. I'm sure you can all look it up if you don't know. And as I was making this slideshow, which isn't as good as I normally would do because I was constantly getting emails from people, as you saw that people still have a lot of concerns and they spoke in public speak. But as I was preparing, something popped up from the Boston Globe just a few hours ago. And it said that Samuel Scarpino, a Northeastern University epidemiologist, was quoted in the Boston Globe today, citing the uptick, and the state should take these numbers as evidence it's time to roll back reopening. Creating any situation that would discriminate and add to any inequities with education is something we must avoid. So I want to think about avoiding a two-tiered educational system where the haves will continue to go beyond the have-nots, the people that don't have the economic resources to provide things for their children. We have to think about children on IEPs and 504s, as we've already been doing. And once again, I've said it many times to these groups on Zoom that I totally appreciate what all of the groups that have been working for the children in this district have done. I appreciate the time and the energy and the research that you have put into these models. But we have to also think about now the children of parents who must work and cannot supervise the remote learning. We are losing precious funding we want to avoid losing precious funding from the public schools. If we talk about hiring vendors such as Ingenuity, that is a cost instead of using teachers in our district. People are talking about homeschooling, and they're going to unenroll their children from our schools. That's going to take away money from the foundation budget. And we all know that there is a goal of some people in this country to further the privatization of schooling. And just the fact that people have talked about in our district that they are looking towards charter schools right now because they are offering them things, that's because of all the publicity that's coming from our horrendous Secretary of Education that is trying to dismantle public education. There are so many what ifs. Everyone that was talking here was saying, what if this, what if that? We have to think about the metrics. But there's only one way, and I don't know, you said I'm not supposed to talk about what my vote will be, but I'm giving you different ideas right now. So you tell me that if I'm going beyond where I should go. But in that group that I talked about, I was very fortunate to connect with somebody on the school committee, also a teacher from Everett. And the superintendent in Everett said, we can't think about the what ifs. That's where I got that from. We have to think about what we have now. And this is not a model I am proposing. I am showing you that this was their draft, but they have already determined that they are going to do something which is fully remote. And you see that in order for them to provide things to DESE, what they did is they gave DESE what DESE wanted, and they gave a full in-person model, and they also gave hybrid model, and they gave dates. But once again, what if? We don't know how we can even correspond to these dates. And I have to thank Everett for allowing me to share this. And I have to also say that this is their draft, but they have agreed to go to a special fully remote plan. But I also want to tell you that they had, I think they told me 400 people that were working on these plans, including the politicians from the city, business people. So it was a community involved plan. But you can see right now, I said remote before, but right now this is remote plus. I want us to think out of the box. I've said that every time I've spoken here. I don't want us just to say remote or just to say hybrid. I'm saying remote plus because this is Easthampton. We have a unique community. We have to remember that it does take a village, and I know we can do it. How can we do it? So I am suggesting that all students in grade 3 through 12 will be taught by their Easthampton public school teachers, and with a remote model 3.0. We haven't seen a remote model 3.0. We have to work on that model. I want it to be under the stellar supervision of our curriculum coordinator, and we know what amazing work Julianne Levin does. I haven't talked to her about this. I did not do anything against meeting laws. I knew that I couldn't speak to any of my colleagues that I admire and I respect on this committee because it has to be done in a public forum. We, as you have already done with the different models, you have to look at students with special needs that we've defined, the students on IEPs, 504s, and English language learners. They can have their own specialized hybrid model with the support that they need in a safe zone in one of the schools, not the schools that we decided that have to be torn down or used in other ways because they were unsafe in healthy situations. We voted to make a new pre-K through 8 school because we know they weren't safe. Why would we think about putting anyone in them right now during a deadly pandemic? So we can think about pre-K through 2. I probably spelled Nonotuck wrong. I'm sorry. I didn't even have a chance to go over and look at this. I said 3 through 12 could be remote. I know that other districts have already purchased tents. We can talk about that. I am heartbroken to think about beautiful faces that would have to be covered by masks on the first day of school that they will ever attend in their lives. I don't want that to happen. If we can't see their smiling faces remotely, then at least they should be outdoors where they don't have to wear masks, but no teacher should have to go into any building and be with any student of any age that a student is not wearing a mask. So what is the plus? How do we help all of the students in this district? Some students do not have the support at home. And I have talked to friends of mine who begged me to go for a hybrid model. I respect them and I love them and I want their children to have the best education they can get. If parents are working, I know it is very, very challenging to be able to guide your students. So what can we do? We can set up remote learning centers. That's what Everett has decided to do. So in the remote learning centers, we will not provide instruction, but we will offer student support. As I said before, the instruction will be given by Easthampton public school teachers in a remote fashion. Our special Easthampton model can have a different model for our youngest students if that's what we decide. But we have to look outside of the box. We're a special community with special families and phenomenal teachers, and we must respect our teachers. So Some teachers may feel that they want to go and be in person. So they can go and staff these learning centers, but it's not going to be two-tiered education. All the children get the same education. Everyone has to be Corey checked. We could also have any of the staff that won't be dealing with students. They could be in these remote learning centers. Maybe we won't have enough people. So one of the other towns, I think it was Arlington last night, I was on a special Zoom with my little group, and they said, we're gonna get local college students from Boston to man these centers. I said, whoa, we're in a 5-college system. If there is time to get them quarried, students, even our local students in Easthampton, some of them have decided to not go back to school. I am sure in a safe way, they could help the children work with our remote education that is not going to be just Zoom meetings. It's going to be exciting, it's going to be innovative, and it's going to be robust. That is what I have to throw on the table and give us a chance to talk about in our work session.
Okay, thanks, Lori. I have to say the one thing that I really cringed at, and Lori and I have a lot of the same ideas, but the one thing I really cringed at is having local college students and community members working. It really, that's kind of a tricky ground, because my worry is that everybody that person has talked to and wherever they've come from is potentially another contamination. So, but other than that, that's very interesting stuff. Eddie, I have something to go along with Lori's. Is anybody want to jump in before me?
I would love to just hear, Laurie, if you could talk a little bit more about the idea of the remote learning center. I really like that creative thinking as a way to help those students who otherwise are at home without parental support. I do wonder, how is that going to be a safer space than a classroom with a teacher in it? What makes that a less risky scenario?
You're on mute, Lori.
Thank you. Those are great questions. And I don't have the answers to all of this. And I do have to say that I wanted to speak to the person who is from Everett, but she happens to be at Acadia National Park right now and offered to speak to me tomorrow when she gets back. And she was with Spotty Service, giving me all of the answers that they've worked through. We're also a very different town than they are, because they can't even set up any type of area with tents, whereas Arlington can. So what I was getting by talking to all these different towns and people, that I was trying to take the best of everything and trying to mold it into what would fit best here in Easthampton. So I think that we could make it safe, Marissa, because we could put these learning centers in very safe places with wonderful HVAC, like the high school. And we would limit the number of people, and we would have the spacing, and we would have the requirements. I can understand Cindy's concerns. You know, I'm somebody that doesn't do anything during this pandemic because I'm so afraid of it. So if somebody commits to working at it, they would have to commit to being very safe, doing all the things like not going out to parties and being isolated. I think it's something that they would have to sign if they're not part of the school system. People are asking teachers to go back and be with the students, and maybe we have enough members or people who already work for the Easthampton Public Schools that could fit into this. These are numbers that I don't know how they'll turn out, but it was such an exciting idea to me, because you've all heard me say we have to be remote, we have to keep everyone safe, but I'm listening to the people who say they can't do it that way. I told you every time, I hear you, I know you have to work, I know you have children crying and saying, no, I won't go on the computer. I want to give everybody a chance to educate children, but be safe. And I think we can work it out. If we use the healthy buildings in the city and not even consider going into our unhealthy buildings, I think we can make it work. And use tents, as I said. If you want to have the younger children outdoors and see if it starts, you know, in a a healthy way that way, let's do that. This is Easthampton.
So you stole my tent thunder.
I thought you were going to go first.
No, I let you go first. I'm only kidding. You and I are just on the same plane in a sense. Tomorrow, we have to choose a hybrid plan no matter what. We have to choose one so that if and when we ever can go, we have one that we've chosen. So that's one thing that I believe we have to do tomorrow. However, I've thought about this long and hard, and this is why Lori and I are in many ways around the same plane. 6 feet, masks, ventilation, ventilation, ventilation. What has been driving me crazy this whole time is the idea of us putting kids and teachers in rooms with inadequate ventilation. So I sent to the school committee today the article that learning during tuberculosis outbreak in New York City was done outside. And it was done outside without masks. It was just done outside, plain and simple, under tents. And no children and no teachers got sick. So I hope you guys all had a chance to look at those great pictures and see the article. And we can send out that link if anybody's interested. So because I believe so much in tents and ventilation, I've priced them and I've sized them, and I have asked the mayor if it is possible for us to use the beautiful open spaces of Nonotuck. And I got an answer this weekend that it seems like we could potentially do this. If we did, just as an example, we could get a 20 by 30 foot tent, very tall, no sides. So there's plenty of open air, and it's $500 a tent, which might sound like a lot of money to buy a tent, but we get reimbursed for this money. Anything we do creatively to get kids in person, I think, I know we can get reimbursed for. We would have to set up hotspots and boosters out there in the field, but I think that's totally doable. And my own thought is that I'd like you guys all to think about this, because it's just an idea of mine, that if any teaching, hybrid, any, learning spots that are created should be in the open air, at least until, my guess is we could probably do it till November 15th. Might be a little cold, kids might have to bring, a jacket, but I think that we have a potential for being able to do that for quite a while. And I can't say enough how much ventilation is key. If we've learned anything, we've learned masks, 6 feet, and air, ventilation. That's why it's so much safer if you're 6 feet apart outside. Even if you're 6 feet apart inside, you're not as safe. So I'd really like everybody to think about that. I have not, the mayor asked me if I wanted to call and start real conversations. I did not want to go any further with this except to tease out the idea, but I believe if we do any hybrid in the future, I don't care when it is, to begin with, until we learn what this virus really is all about, I would love to see us think about doing it under tents as our first step. Another thing that I'd like everybody to think about for tomorrow is bathrooms. Bathrooms, especially ones that teachers use, have absolutely zero ventilation. You can wear a mask, but the mask does not stop the virus from going through the mask. It just cuts the distance. So if you've ever seen those great displays where it's 12 feet if you cough, and it's, 9 feet if you speak loudly, and 6 feet if you're just talking regular, and then you put a mask on, and it only goes like 6 inches to a foot. It's not going into the air. It simply is not going very far. That's why distance makes a big difference. I'm very uncomfortable right now with the idea of 20 teachers using a bathroom that somebody just used. There's no air movement, there's no window. And, if you went to Nonotuck and you went to the bathroom in that building, that's at least open air. It has windows, has an open door. There's more air circulation. There's no air circulation there. I have thrown out the idea. I've begun throwing it out everywhere I can. They have ultraviolet machines that can be used to, like they use in the hospital, to clear a room. How often that would be is, again, that's a very tricky, delicate thing, but I believe that at the very least, if you're going to use one of those bathrooms for teachers or students that have no windows and no circulation, we have to have those UV machines. So I would like just everybody to toss that out as an idea. The other thing I want us to think about is choice students. I love choice. Please understand, I love choice. That helps the district to keep going, and we welcome choice students. But if we look at our numbers as we talk, we cannot just look at Easthampton. If you just look at Easthampton numbers, you will say, oh, okay, well, not too many cases, we're pretty low. So what I asked Dale to do is send me a list of, and I don't know, Dale, I know you're on. Did I have you send it to everybody? Because we could send it to everybody so they could begin to keep their own numbers. I got a list from Dale as
We all have it, Cindy.
awesome, as to who choice students are and who our CTEC cities are. And if you look at some of the cities that we are taking kids in from, their positivity rates are higher than they are in Easthampton. As an example, I'll give you, last Wednesday I did these numbers, and Chicopee is at 3.32. So that is much higher than Easthampton's 1.77. So what I'd like everybody to think about come tomorrow is understanding that we are not just looking at Easthampton as though it's in a tiny bubble with nobody coming in. Not only are there college students returning, but we have kids and teachers. I didn't even ask how many towns teachers come from, which I'm sure is another whole list in itself. But I think that we have to keep that in mind. So it's almost like you have to think choice communities, CTEC communities, where are our teachers coming from? Look at all those communities. When you're looking at all those positivity rates, then you have a clearer picture of what the health of our school system will be. The other thing that I don't understand, and I don't know, maybe the mayor can help me with this one. I really do not understand why we cannot get every teacher and every student tested before they go into any learning in person at all. Pro baseball players get tested, football players get tested. I just heard today they're even thinking of testing high school football players. So why can't we test teachers and students? Do you have any sense as to how bad that is?
So my understanding is that the center in Agawam is set up and it's going to remain up, and that is no cost and people can drive up. I say this very tentatively because I don't know 100%, but my understanding is that state testing centers will, I think Agawam is operational and Springfield will also have one. So as far as teachers being able to be tested. The trick to that is, you know, the tests are only as good as fast as you get them back. So I do see the state working harder to get those kind of testing centers out here. And I know that if that opens, it'll take some pressure off of Cooley Dickinson, who's doing testing, but mostly with the med odor. So I just, I don't think it's impossible. Certainly happy to follow up. And I know Bree is on the phone with Boston about that stuff all the time. So testing is picking up out here. Free testing is picking up here. I don't know the turnaround time, but certainly we can definitely look into it. Yes.
It just seems crazy. Even,
Yeah.
I mean, Allison, I know that you talked to Commissioner Riley. It just seems crazy to me that we are not, just as a whole state, advocating to get our teachers and our students tested before we even think about which way we go.
Yeah.
That's.
And I actually spoke with Senator Vellis about it today.
Good.
So he was on the same page with that as well.
So he agrees?
Yes. Well, he agrees that we need more testing out here. And he understands the concerns about the quantity of testing and the turnover in getting a test result back. And how that, you know, contributes to the whole situation. So we need to kind of improve that.
Anybody want to comment on Lori and my idea of tents for hybrid learning?
Can I,
Yeah.
oh, go ahead, Maren, you go.
Well, so one of the other thing, there's two other surveys that has data points that we were going to be discussing tonight too. We've sort of dived into different people's thoughts and opinions, but I just want to throw that out there. Do we want to take a step back and do that, or do we want to continue down this track and then come back to them?
It's not my, you know, I can go any direction you want. Are you thinking of the teacher, the union survey?
We have a teachers union survey, and then my understanding was Sarah Mochek did a student survey too, which I had not seen the results of yet.
Oh, that's true. I haven't seen that either.
I think Sarah might be on this call. She might be in the room.
Okay.
Yep, there she is.
Sarah, do you have some results? Because I've got the teacher one printed up right here. It's a good idea, Mary.
Just give me a minute and I can find it. It wasn't.
So can while Sarah's finding that and getting that up to show you, can I just say I've been thinking a lot about the remote learning, and really trying to focus more on that model. And I've been talking to other communities that are leaning towards a remote model. There aren't too many, you know, just in the immediate area, but there are some a little further out. So I've reached out to a few superintendents that I know. And I thought Laurie was going to touch on this with the remote plus, and maybe you did, Laurie, and I didn't capture it, but with the remote plus, I've seen that label in other communities that are looking at, you know, beginning possibly in a remote model with a phased in approach. And I think Laurie kind of alluded to that a little bit in the Everett slide that she showed. So if you looked at a phased in approach, and we thought about, okay, there are core students that we want to educate in person. And whether that's in a tent or not in a tent, I don't think, you know, we can get into that. I'm not gonna, I don't need to discuss that now. We can talk about that in a little bit. But there are certain groups, as you've all articulated, the specialized populations that we would want to focus on in person, and possibly the rest of our students would be remote. I did talk to Hoosick Valley today and Greenfield. I say those names because I think you can look them up if you want to, who are looking at staggering in students in a remote model, like maybe focusing or capturing in your phased in approach, your specialized populations, maybe your pre-K students, you know, initially just to kind of get the youngest ones in. I think similar to what Laurie was saying about being face-to-face with the youngest ones, and then maybe reaching a threshold to be determined by those that have more medical background than I do, like 3 weeks in, where you take a look at what your data is telling you, and then you look at bringing another group of students in if you're being successful and the metrics are where you want. And a lot of people are talking about transition grades. And we've talked as a committee and also as a leadership team about the anxiety that some students are going to maybe be facing going from one school to a new school. So maybe in our, and I've got this on paper, I can share this with you after, you know, maybe including, you know, in phase 2, 5th grade and 9th grade, bringing those students in that are willing to come in. And they can, you know, the rest of the student body would still be remote. And then, you know, going through another few weeks and seeing how that works. And if numbers are still where we want them, then bringing in more students in a phased in manner. And I don't want people to be upset that, you know, some students are included and some students are not. I'm just trying to be thinking with this ideology of kind of, you know, who should we be focusing on and getting students in, being successful, you know, working on what we need to do. So that's what I'm seeing. I think Greenfield is putting forward a remote plus, and the plus in their case is some of these additional groups that they're bringing in. So that's just what I would kind of put out there to also start contributing to the conversation tonight. But I think Sarah might be ready, so.
So we submitted we created the survey, the student survey from the health and wellness as a part of our health and wellness committee that I was facilitating. And our initial reason for wanting to reach out to students was so we could help support them with the social emotional aspects of all of this. But when we ended up sending it, so there's a lot of qualitative data in the survey, but we decided we wanted to just ask students, do you feel safe and ready to come back into the school building? So there's a lot of data that the wellness committee will look at because we gave students a lot of opportunity to have a voice in this. But I can show you at least the results. So we did a K-5 survey and a 6 to 12 survey. They are the same questions. We just changed the language a little bit. So we asked, so this is the K-5 survey. So we asked, do you feel safe and ready to come back into your building in September? So with the K-5, let's see, 38% of students said yes, 32% said no, and 30% said not sure. And then we asked them some questions about how they felt about how remote learning was for them. Was it easy? Was it hard? How do they feel about coming back into school? So we used a Likert scale for them to rate these things. And then we gave the rest of the questions are really, we gave them an opportunity to it's qualitative. So we'll be looking more at this as a group, as I said. We asked them what they've done to take care of themselves, lots of exercise and being active. We wanted to know what families were doing, and then how we could capitalize on that and help them along. Let's see. And then we also asked what grade. We did it by grade as well, so principals could look at that data a little bit. Let's see, I'm going to stop sharing for a second, and I can go to the If you just give me a second, I can go to the 6 to 12. So with the 6 to 12 survey, grades 6 through 12, do you feel safe and ready to come back into your school building? 47% said yes, 29 no, and 24% not sure. So we asked them the same questions, how to rate remote learning, how they're feeling right now. We asked them to describe how remote learning, how was it easy, how was it hard, what they've done to take care of themselves, how we can help them return to school, and then anything they would like us to know. And then again, we asked what grade, so principals and teachers can look at that. So that's the student data, and we'll, as I said, the intention was originally to gauge the social emotional well-being of our students. But as we were getting closer and talking more about what we would be doing, the group felt it was important to ask students whether they felt safe and ready to return to school.
Thank you.
Thanks for sharing that, Sarah. I appreciate it.
Thank you.
So then we have the union. We have the educators. And what we did is we asked them to kind of summarize everything that they had been talking about.
Cindy, should I put that up on the screen? I know you just printed it, but
Yep.
I can put it on the screen if
Yep.
you want.
I've not had time to read all those great suggestions that are in there. I will do that tomorrow. So we are looking at, we can kind of scroll down through, there we go. So the majority were educators and paraeducators, but there was also administrative assistants and custodians. And then we asked where they worked, and we have that breakdown so you can see it's pretty equal, except let's see, Pepin is tiny and center, but they're almost, we've just got that little tiny bit for 50 pace and prefer not to answer. So the next one, 78% of respondents currently feel unsafe working in buildings with staff and students. So that's important information. 5 is very unsafe, 4 is unsafe. 58.5% do not plan to return to work in buildings.
This is opposite, actually. This was the.
Actually, yes. Wait a minute.
Yes, that's what Nellie had sent the correction because I
Oh,
got
that's
it.
right.
Yeah.
Thank you.
Yes, no, sure.
So the yes is supposed to be, so the 58.5 is correct, but the colors are wrong.
No.
Correct.
It's
The 58 do not feel safe, and the 38.1 do.
No, 58 point, what they're saying, as of now, do you plan to return to work in the buildings? 58.5% say yes. And she did so many wonderful things with the data, but this was just a little bit of a typo, I guess.
yeah.
So it's the opposite.
They plan to return, not that they do not plan to return. That's
They
all.
do
The
not.
data
They
here is
plan to
correct.
return. The
It's
data
just
is correct.
The typo here is that it should not have a not.
Okay, thank you. Okay, so it should not have a not. Got it. All right. far as you know, are you in a high-risk group? Do you have a close loved one who is in a high-risk group that would prevent you from returning to work? 49% said they are, and 34% said no, and 16% preferred not to answer. But almost half, that's important information, to have a loved one or themselves are in a high-risk group. And in 6 weeks, if EPS can meet all bargain safety standards, 76% of the respondents would return to work in buildings. Okay. And then there's
a lot of commentary.
I've not even been able to read them all, but I'm sure they're really good. We just got this today. 57.6 think that a hybrid option 1 is better.
That's just between the two hybrid options, though. That's not trying to compare or choose. It's just between the two plans.
We asked, because we have to pick one, we asked for some feedback about which one is better in their opinion. So 57.6 say hybrid 1.
I think that's in line with families as well, Cindy.
Yeah, I think so too. In a hybrid model, would you be willing to work with students outdoors in an open-sided tent? I've been throwing this out, and 77% of respondents said they would be willing to work outdoors. That is huge, okay?
It's the same percentage that said they would work in school, though.
No, it's not the same percent that said they would work in school. No. Are you talking about the percentage that said they would return to school?
Not even that.
That was 58.5.
76.7 versus 77. We're talking the same number, basically.
Well, that is if the whole list, there's 19 health and safety standards that are being recommended. So that would be with perfection if all of those were met. So I see that as slightly different. In other words, today, if we had outdoor tents, 77% of our teachers would feel comfortable teaching in the open air. And this is, again, why I really want everybody to think about this as a district. And I want to just quickly purchase as many tents as we possibly can. I think that this is key to opening up whenever you do this.
I think there is one more.
Nice ventilation. We do have one more graph. There we go. 55.9% of staff have child care needs that impact their decision making. So, you know, you have teachers who have children. Some are at home, some have to go to a program. How are you teaching in person if your child is at home remote? Dr. Leclerc?
I was just going to say that the commissioner is also hearing that, and they're working on some aspects of that. Even when I talked to Senator Velas today, I know that they've got some ideas if we can designate teachers as, and I don't think designating teachers as essential workers is what I'm trying to say, so I don't want to get people upset. But in the beginning, in March, there were people that were able to get childcare at childcare facilities because of their profession. And I know the senator, I know the commissioner are hearing about this concern, and they're working at a way to designate teachers and support staff kind of in that same way so that they can get access to childcare that may be not available to them right now. So I know that they're working on that. Can I also say one other, because the issue of tents has come up a couple times, another tent idea that I would throw into the mix is we were thinking in a different way about tents. For example, putting a couple of tents at our elementary schools in an open, in an area like out on the blacktop at Maple, if you will, still allowing some space for children to play and run around, but having tents set up so that groups can access tents for periods of time to get out of the building, like to eat lunch or like to have a lesson. And they would, of course, be cleaned and sanitized in between, but it would allow for their classrooms to have a break and then be ventilated. And it would allow teachers to get outside, but maybe not be outside for very long in, inclement weather, rain, colder weather, that sort of thing. So it would kind of maybe be an in-between option. So I just put that out there.
And obviously, I'm just tossing it back a little bit. I'm still concerned about people being in unventilated, poorly ventilated buildings. I am concerned about Maple, Center, Pepin, and Whitebrook. And
okay.
just
I just want to be clear though, those are not unventilated buildings.
No. I that's why I corrected myself. Excuse me.
I need
Poorly.
you to attend.
I think
it's food. We need to get
there is
groceries tomorrow.
There is a huge difference between being in a room with poor ventilation and having, and in terms of, I'm thinking for my own, as I've been doing this, I'm trying to do two things. I'm trying to balance how I feel as a teacher and how everybody feels so that I wear a different hat, which is that of school committee. And I know as a teacher, give me my own tent and put my class in my own tent in the nice open air, I'm going to be very confident. And one of the things, we have heard so many pieces of feedback from parents and educators. One of their concerns is how much time are we going to spend yelling at kids to keep on their mask and yelling at kids to, keep back and stay in one place. In the open air, it kind of relaxes everybody. And I just want everybody to think about it tonight, and we can talk about it tomorrow, but I think you get more than a couple. I think you put everybody in their own tents. That's the way I envision it, but Lori?
I don't envision that for the whole district. I envision what I said.
For hybrid?
No, remote with learning centers and tents for the younger kids. I think that if we give our high school students, our middle school students, wonderful, vigorous, remote classes with their teachers, online, but not online all the time. We have Drea Marks, who's ready to jump in, train everybody. Dr. LeClaire has already spoken with her. We're so fortunate to have her on board with this.
Right, but I think we're saying the same thing. I'm not talking about jumping in or telling my vote either way. I'm saying when we go hybrid, whenever that is.
So not tents, because it seemed like you wanted tents for everyone at the start.
I would like tents for any time we go hybrid.
Okay, and I just want to clarify. I just want to clarify something because I'm a rule follower and I don't want to be made to feel like I shouldn't be talking because I'm giving away my vote. What I am doing is working in a work session, and if we were around a table and people were able to be there, I would be saying these things because we have to explore all ideas.
Correct.
And people know the way I feel. but I want to explore everything, but I don't want to be made to feel like I'm not following the rules.
No, we're doing okay. I think we're doing okay. I think Sue would yell at us if we weren't. She would stop us. So Allison's laughing. Yeah, no, we're doing okay. I'm sorry you misunderstood. I am talking about my personal feeling is that whenever we go hybrid, I would like us to think about tents whenever that happens.
But I did want to finish about the teachers. Can I just finish my thought?
Yeah.
Because I was listening to Alice Wanamaker say that she wants contact with her teachers. Yeah. I value that so much. So building on your tent idea, even if we have this wonderful remote program, if we have some extra tents around, and I know people have to be very careful in certain situations, but maybe those tents could be used for different meetings at different times. Correct. If the students and the teachers felt safe to do that. Once again, we have to think of different ways to explore all of this and not just be in black and white. So correct. The tents could be around different places, not just in Nonotuck. And if Alice's class wants to meet and they're going to be apart in a tent and they can feel like they're having a wonderful, engaging conversation, let's get some more tents. But let's develop that remote model first.
Yep. Shannon wanted to say something, but do you still want to say something?
I do, but Maren was first. I'll go after him.
Oh.
I'll just, real quickly, I'll just throw out, you're still gonna have a bottleneck issue with bathrooms. So there's still, bathrooms are a big issue, and porta potties and all that kind of stuff are going to be a very big issue if we were to move all classrooms outside into some place away from everything else. So that I think one of the places where I think about this, it's like, it's not sort of where you can set up one ideal situation. It's about figuring out where all those bottleneck points are that lead to that spot. So that's
we do have a field at the high school, and we do have very more open bathrooms at the high school. So, I mean, I wasn't thinking of tents just in one spot. Does that make sense? Shannon? Shannon?
What?
You wanted to talk?
Oh, are you done, Maren? You're all set? Okay, good.
You guys don't have to be on, you don't have to be on mute right now because there's really only a few of us on. So I think it's okay for you to just relax. I'm not hearing any feedback.
I know, but I have like critters and kids and all kinds of things running around. So I've been thinking about this a lot, and I listened to, I heard what the mayor said at our last meeting regarding phasing. I think that is a very ideal situation. I heard Allison say it tonight, and thank you for that. We need to come up with a phase, like the 5 phases and what those might look like. I think at this time, we cannot, in good faith, send people into Maple, into Center Pepin or Whitebrook. I agree with you, Cindy. The ventilation systems are horrendous. There's one restroom for how many women? It's horrible. These are, I mean, I just wrote down some thoughts after reading all of the parent emails, and thank you all for sending those to us. I appreciate it. I don't think we're ready to open our schools or to go hybrid right now. We don't have good ventilation. The restrooms are, again, they're a sticky, sorry, see, that's why I'm on mute. They're a sticky situation, and we don't have a plan. Like, when are we going to use the restrooms? How are we going to get there? Who's going to clean it afterwards? You know, like, I haven't heard any of that yet. Same with lunch. How is that going to, how are we going to be in a building and have lunch. You know, I haven't heard any of that. I haven't heard anything about transportation. I haven't heard much about mask breaks. Yeah, I heard, and I've seen all the schedules, how they're going to happen and where. You know, are they going to be staggered? Are they going to be all at the same time? I mean, I just feel like our systems are not robust enough right now to let anybody in any building. And I think, you know, I'm shooting for phase 1 being remote and move on from there. And I love the ideas of the tents, I really do, but we're in New England, you guys. It's not a feasible option, and it's, I mean, maybe temporarily.
You got spring and fall. You got spring and fall. I'm an optimist.
It's just hard to.
It's not going to last forever.
To come up with the what ifs. We need to have this is what we're doing, and keep in mind all of the what ifs, but have something strong and focused, and let's move forward.
So
in phases.
I agree with you. Another thing, though, that I want to throw out that I really want everybody to think about and toss around for tomorrow is, no matter what we choose, first of all, we have to choose a hybrid program so that we know what we want to go back to. And I agree with you. One of the things my district did, and in all defense of Easthampton, my district is really tiny. But they did a day in the life of. So what time the kids come in, how long they learn, when they get their mass break, when they have their lunch, where they're going to go, they're going outside, so that kids could learn. And I think we have part of that, and I've seen part of that. But we can work on that for hybrid whenever hybrid happens. But for remote, whenever remote happens, I have to say, I have been looking at a lot of emails and a lot of suggestions, and our remote plan needs work. It needs to be more robust. It also needs to be flexible. So if we are doing remote, and I'm not happy with what I'm seeing right now, and again, it's not, this is really hard stuff. Everybody's working as hard as they can, but we need to take into consideration, all the different factors. For instance, if you're doing remote, someone made the great observation that their child may not be able to do that remote lesson at the exact perfect time. So we've got to be able to do some flexibility of time and lessons, and have limited, everybody across the board has basically said they don't want their children plugged in constantly. So I think that there's a lot of work to be done on the remote model. No matter what we choose to do tomorrow, we have a lot of work to do to fine tune this. I do think we have time. We need a lot of parent input. I print them up the second that I get them, because parents have given such great ideas. So have teachers. They've been sending all sorts of ideas of how to fine tune these schedules. And if I'm a third grade teacher, I'm the expert in how to work with someone to help that be a great hybrid or remote model. If I'm a sixth grade teacher, that's a different picture than my third grade teacher. So I think we have time, but there's a lot of work that has to be done to fine tune those schedules. Lori?
Marissa's hand was up, and I'd really love to hear Marissa, and I haven't heard from Jonathan, or I really just want to hear from all of my colleagues on the school committee, because I respect their opinions. I've done so much research and talked to so many people. I want to know what you think about these remote learning centers. It seems like it's just been blown over if we start in a remote way. So can Marissa talk, and then can we hear from other people? Thank you so much.
Thank you, Laurie. That's kind of the perfect introduction because I don't actually have anything new I want to say. I just want to reiterate some things that I'm hearing that are my main priorities as I am looking ahead to the vote. The first being that school committee members are not public health experts. I feel like it's really unfair that the state is pushing this decision down on us. And because of that reason, I really like all the suggestions here that we should have health metrics guiding our phasing. And so even if the state has not yet provided that or won't provide it by tomorrow night, I think we need to have some system that we link to, and perhaps we'll revise that when the state does get a better system for us. Every other business and service in Easthampton and in Massachusetts has some kind of metric that they're able to follow. And it's just such a weird anomaly that the school system is not linked to that same kind of actual evidence-based way of thinking about things. So yes, definitely interested in health metrics attached to remote only and hybrid and however we might phase between those two. And to piggyback on Cindy, I really think remote learning needs to have that flexibility for families who can't facilitate synchronous learning for their students. I know as a working mom, I can't do it. And I am super invested in education. I'm an educator myself, and I won't be able to get my kids on time for a bunch of classes. So there needs to be that flexibility. And I think as school committee members too, we need to be pushing back up at DESE for some reprieves to some of the accountability for attendance, accountability for meeting certain standards, testing, that kind of thing. We have to anticipate that families are going to fall off track with their attendance and with their capacity to meet certain standards. And we need to make sure that that does not come back and hurt our district, but that we are pushing up to DESE that they have to give us reprieve for this time. And then thirdly, I totally love the good feelings we have about Easthampton. I completely agree. This is an amazing community. I could not be happier to live here. I also think that we need to recognize that the kind of like incidental private organizations of families that they're just that, they're incidental and private. And so for some families who have gotten into those networks, they're going to be really wonderful and they're going to help those people get their kids through this incredibly difficult time. However, there are a lot of families who don't know how to access those networks or simply won't access those networks. And public school system promises a fully accessible institution for everyone. And so we need to not sort of count on the community, but we need to provide that. And so for that reason, I really love the idea of remote learning centers if we are going to be in a fully remote model, something that can function along the line of a daycare for younger kids, an instructional support center for older kids. One last, just like, you know, I'm sure I could endlessly talk to my anxieties, but I also just want to mention that I love that the remote learning model will protect our teachers. I also always worry about the ways that we kind of push risk down onto even more vulnerable populations. So if we are keeping our teachers home, but we open a remote learning center, I want to make sure that we are really careful with the risks that we're exposing probably underpaid, perhaps non-unionized, maybe uninsured employees who are working in those remote learning centers. So I think we would need really high standards for space and distancing and masks and all that. Final thing, just wanted to mention, my 5-year-old wears a mask and is awesome at it. Kids can learn these things. I know there are some developmental and personal reasons why kids struggle with them, but it's possible. And I'm really, you know, I think that we need to encourage that even in our youngest kids. All right, I'm done there. Thank you.
No, thank you. Jonathan and then Maren.
Can I just ask a point of clarification
Yeah.
first? I'm sorry, Jonathan. I'm very confused by the concept of a remote learning center. How are we suddenly using buildings that aren't ours? How are we talking about bringing in parents or college students that aren't on our staff? I don't even understand the concept here. So if somebody could please, if you want to clarify a little.
I'd love to clarify as much as I know how to answer those questions. As I said, the cities that have already signed on to this type of thing, I'm trying to get more information and pick their brains, and they're all doing this in different ways. But the way it was explained to me, in Everett, they're going to try to use the people that are already employed by the school. So your office staff, your paras, teachers that really want to be in person with the students. And maybe that's enough. We don't know what numbers. But then, as I said, it was Arlington that said, oh, we're going to even dive into the college population. You would need time to query them. And it would be an interview process. This isn't teaching. That's what you have to realize. This is supporting the students who cannot get the support for various reasons in their homes because parents are working or other reasons. They are going to a place where they're going to get the support. In addition to that, I think I failed to mention that there's also technology support tied into this. They are doing technology support, technological support centers in these learning centers, as well as remote technology support. So even, initially there are some families that just don't even know how to get on the platforms. And Drea knows how to teach that. But what if somebody can't get on Zoom to learn how to do that? So in a safe way, and I did preface it by saying, not in the buildings that we don't want to have classes in, but we had even talked about a hybrid model that was designed to put people in the high school, which we know is a safer place. I'd like to talk to the mayor and see if there are other safe places. We don't have a lot of those places in Easthampton because I know a lot of times we use the schools to have those meeting places. But even on a rotating basis with the learning centers, it doesn't have to be that those learning centers are going to be occupied by the same students for a significant number of hours each day. It can be on a rotating basis based on the needs of the families in Easthampton. Did I answer your questions or do you have another one?
I just feel like you've instead of moving us towards more clarity, I feel like, and while this is brainstorming, so I appreciate it completely. I just feel like that opens up even more questions and uncertainties that I personally don't know if we have time to speculate on all those things. But that's what we're brainstorming. So it's totally fine for that.
So I was afraid of that. And this is the only, like I had said to Cindy, once again, I did not talk about this to anyone else on the committee because I didn't want to go against our meeting laws. But I did say to Cindy, I'm bringing up an idea that has so many different variables. I don't know if we're going to be ready for a vote tomorrow.
Right.
Because I want to explore this. I want to be able to provide the necessary services to educate every child in Easthampton. And I don't want to blow off this idea because there are a lot of unanswerable questions right now. I will find out the answers because you know who I am, Erin. And that lady from Everett is coming home from Acadia and she said, I'll talk to you tomorrow. I'm like, that's gonna be too late. I have to present this tonight. Send me your questions. The community, please, email me, send me your questions, and I will try to find out the answers.
Jonathan?
Shall I?
Oh.
Shannon, was your thing related to that? No, okay. So thank you for the opportunity to talk. I was in some ways satisfied to sit and take in all of these great ideas to kind of help align my opinion to lay out to everybody tomorrow. I will say I am extremely heartened that we have begun in earnest to discuss this idea of a phased in approach. I feel like for a lot of the conversation and in a lot of sort of the conversations we've had internally and in the community, it's been a lot of, this is the idea that I want and this other idea is the one that I want, when in reality, underlying all of that, we've had the same, a parallel conversation about the importance of flexibility. And I think, as I've thought about this, and we think about flexibility, we're going to be looking at probably using multiple models throughout this year. So my thinking has been, our teachers have been thriving as in-person educators for years, and it is this idea of remote education that is new and that students are really struggling with. So I've sort of really heard the community's concerns around that, and agree that, you know, no matter what direction we head in, the remote plan is going to be of utmost importance as far as the preparations and trainings that we do. I have a sneaking suspicion that we're going to be in a very different landscape in a few weeks, and it seems really hard to, you know, just try to make a decision now without this idea of starting slowly with an abundance of caution, as some people have said. So all of that in mind, if we assume that at some point we will be engaging with remote education, even if it's just within a hybrid system, there are undoubtedly countless families in our community that are going to need additional support. I don't know if remote learning centers are the, you know, we talk about all these questions that we have about it, but at least it's an idea of, you know, if we're putting these families in a position where they have to engage with remote learning despite all of the obstacles that they have at home to do that, what are we as a district doing to support those families? And I think that it's really important that we're having that conversation. And I think kind of focusing on this point that it's not a place for students to come and receive their education, I think is really important, especially as you mentioned, I think Lori, you know, the staffing that we have in these, we can't, you know, we can't continue to expect such huge things out of people that we can only support so much. So having it be a place where students can get their technology questions answered, or where they can get a little bit of extra help with, you know, understanding their assignments and that sort of thing, but not receiving the core of their instruction, is really crucial. I'm still sort of hedging my bets here as far as, like, you know, wanting to save my opinion for tomorrow. But I certainly appreciate the out of the box thinking that we're doing here. And I don't see tomorrow by any, and I doubt any of you, I think you all share my perspective here that tomorrow is not an end game. Tomorrow is the beginning of moving forward in earnest. So there will be a lot of questions still to answer, but at least we'll have, you know, that goal that we're moving towards. So that's kind of what's been going through my head as I sit here and listen to your great ideas, folks. Yeah, I don't know.
Shannon, I have something else I want to say. And Shannon, though, first.
I was gonna do, sorry. I was just gonna respond to what Lori was saying in regards to, you know, I think it's a great idea, Lori, the remote learning, the access, but we have to choose remote learning first. You know what I'm saying? So it's not something that we have to decide, yes, we're gonna do it, or no, we're not tomorrow, you know, but I definitely, I love the idea. I think it's a great idea. It goes along with a lot of the things about, you know, the equity that we've been talking about all along, as being part of the plan, but not the plan. Does that am I making sense?
Yep.
Probably not.
You are making sense, but I'm still confused because what I want to do tomorrow is not just vote on a hybrid plan, because I don't think we should start with the hybrid plan. I've been saying all along, we have to develop the remote plan to protect our community. So we can say any remote plan, and I believe the phase-in model. Everett was doing the same thing. That's what I showed you. They had every aspect of DESE's demands, full person, hybrid. I mean, we can vote on that. I agree. But tomorrow, our community should know how they can plan to educate their children. The teachers need to know what they're going to do.
Well, okay, can I just weigh in for a second, and then poor Dr. LeClaire and then Maren. So tomorrow, my understanding is two things. We're going to pick one of the options for hybrid for whenever we go hybrid. That doesn't mean we're going hybrid or making that decision tomorrow. And then let's say we choose remote tomorrow. no matter what we choose, I believe that this is such an unprecedented, complicated problem that we're going to have to go right back to the drawing board and fine-tune plans that help the rest of the community. If we went hybrid, then many of our families are not going to come into school, and that is their right. So no matter what hybrid, if we said hybrid tomorrow, those parents have a right to a remote program. And we have to have teachers who are willing to provide quality education to that remote piece. If we were to choose remote, there are family members who must send their kids in. And we have to find out what teachers are willing to come in. And once you know what teachers are willing to come in and what students need to come in and what families need to have their kids come in, then you have to start planning for how you're going to service those kids. But you're still going to have this whole piece of remote learning that has to be quality too. So I believe that we are far from the end, that we are just taking the necessary steps to get the commissioner to have their answer as to which hybrid program we like. And then as far as I know, we go back to the drawing board on every single plan that we're putting forward, be it remote or hybrid, because none of them are finished. And they're not finished until, one, we know what parents are going to send their children, what they need, what teachers are going to come back. Without teachers, none of these plans will work. So we have a lot of fine tuning to do.
Dr. LeClaire, didn't you already submit 3 plans last week or 2 different options of the hybrid? That was last week, I believe, Cindy. This week is not.
We don't have to choose. We don't have to choose.
No. No, so we need to choose
we
what
do
we
want
want
to
to do.
and we don't. We have to choose a hybrid if we're going to make it better.
Not
What we
right
have
now.
to choose, if there's to say, what we are choosing tomorrow is what we are starting on September 14th. That is the plan that we have to have put in place. And then if the broader conversations are, what are the phase-in plans? What are maybe the next couple, like how might we phase a plan in? What we're doing, the way I'm looking at it is it's like we're deciding the bones, right? The school committee has no authority over the flesh of actually what happens, how the teachers teach, what the curriculums are. That's not for us to decide. We're deciding the structure, the sort of framework of the school building, the bones of the body of the school year. That's what we're deciding. So we decide, if we're not deciding to start on September 14th with the hybrid model, we don't have to discuss the hybrid model anymore unless we want to.
Okay.
Right? So
see, I still think you need to at some point work on it and better that hybrid plan. If you chose remote, you have to better the hybrid plan because otherwise you won't be able to.
You can't phase into it.
You can't go into it. But I agree, we don't get into the meat and bones. When I'm saying that it needs to be reworked, I just mean that we need to think about how we're going to be flexible to the entire community. We're not going to please everybody. Dr. LeClaire?
I agree with Marin's point. Your goal tomorrow night is to choose how you want to start the school year.
Okay.
If you were choosing that you wanted to start the school year in a hybrid model, you would then need to fine tune that and tell me which way you want to go. I can continue moving forward in my planning because I know from parent surveys and from teacher surveys which hybrid option people are leaning towards. So yes, as a school district, I need to continue work on a hybrid plan. But again, as I think Marin said, your goal, your job is to choose a plan. Your job is not to micromanage the plan. The plan is supposed to be developed by the school department. And I think we have the structure of a remote learning plan. And I think that people right now are wanting to shift some of the nuances with it. And I will say that our plan was developed with the guidance that we had at the time, and that guidance has not changed. So while I know people want flexibility, we haven't been given flexibility, too much flexibility in our plan. Now, we are going to continue to massage the plan, but we are being told that attendance needs to be taken at the beginning of every class. So now we're going to have another conversation about how that could look. Could a student that remotes in at a later time be able to click on some component within that remote class and say, I'm here now, and that makes it count? We haven't gotten down to that level yet. We have the bones or the structure of a remote learning plan based on the guidance we have. But I think that, you know, a lot of the things you're talking about are suggestions that we can bring back to the leadership team and to the negotiations team, but they're not for this committee to be fleshing out. They're for other people. And remember,
Correct.
a lot of this is still in negotiations. You know, we have a bargaining units that we need to negotiate with on some aspects of this. So what I'm taking away from tonight is, and you can correct me if I'm wrong, I'm summarizing, but I'm taking away that I'm hearing, I had heard last week that remote was something that many people that came to the meeting last week were advocating for. I know what people want, you know, through the survey, but I've heard remote. And so I'm really trying to flesh that out now with my leadership team. But one of my big takeaways tonight is we've started working as a leadership team on the phasing model, because we've heard that from some other people. And I heard that in negotiations the other day. Cindy and Maren were there. And so I think that we're trying to really unpack that right now. So I'm hearing from all of you that that's something you want to explore. So I'll provide you with something around that tomorrow night for you to digest. And I've also heard about the metrics from several of you. I have a conference call with Bree and with Maggie Hebert tomorrow. So I'm looking for more information on the metrics, because my phase, I want to be able to tell you that my phased is based on something logical and not just something random. So I want to be able to give you that information. So those are my takeaways from tonight. And we will continue to explore the tents. I'll talk with my team tomorrow. I've got information. The ventilation thing we're still working on. We're fleshing out a document to share with everyone to correct misinformation and misperceptions that people have. We're fleshing out all the information. I heard from Shannon, like mass breaks, lunch, a lot of those things, we're fleshing that out. So those are all things that are still kind of on our radar, but we have been so invested in doing certain things that we're not going down a rabbit hole on one particular plan until you choose it. So once you choose it, then we're gonna go a little bit deeper.
Then you'll fine tune that piece, okay?
But I didn't hear you say, and we're going to explore remote learning centers to provide places for families who cannot engage in remote learning in their homes. I heard you say everything that was discussed, but I didn't hear that. Did you just forget it?
Well, I forgot it. So I'm sorry. But I do have some of the same concerns that have been expressed, and I don't think it's insurmountable. I just think it's something we need to navigate through with the union. You know, I think we need to flesh out how that would look. But I think that, you know, I hear Laurie's point is well taken, and I know all of you have shared it as well, but she articulated it so well that we've been hearing from so many families that need some kind of option.
Correct.
And rather than going to a private school that's going to be opening up, I would like to be able to provide something within our community that they can access.
If I can just weigh in on that, and thank you for saying that, Dr. Leclerc. it just got me thinking, because we've talked about having sort of additional adults for students to be able to check in with regarding their education, be it support staff or teacher teams or that sort of thing. And I wonder, as we're talking about this, if the sort of remote learning center or whatever path we take to support those families, if that's sort of tied into the thinking and the planning that's sort of already happening around the way that students are being supported individually. So just a thought.
Yes, thank you. I agree.
Well, that'll be a shorter meeting since we only have to choose one thing tomorrow. I really thought we had to also choose not only the direction that we're going to go, but choose between those two. So it's nice that we don't have to.
Essentially, we are, Cindy. I mean,
Yes.
it's already kind of been decided, if you really think about it. You know, which of the hybrid models really is the most.
Well, that's why these surveys were really helpful, the parent and the teacher surveys. So.
I did, and so I have another quick question, and maybe this isn't the exact place for it, and tell me if that's the case. But Allison, you got me thinking again about the issue of attendance, which is something that I had meant to bring up when I was speaking earlier, because I do think that's going to be a significant obstacle for a lot of families to be able to check in at very specific times. Of course, you know, state requirements aside, I certainly see the value of taking attendance to make sure the students are engaging in the way that we want them to. So I was just curious to know a little bit more about the state's requirements as they relate to, you know, what exactly we're supposed to be submitting and what kind of flexibility we have to sort of push back against that. Because, you know, as I've heard my colleagues discuss, you know, this is an opportunity for innovation and to not just follow suit with what we're being told to do. So I want to make sure that we're exploring all of our options, even if they're a little bit outside of what is maybe being required of us. And I didn't know if that was something we could just speak to or if there'd be a better time for that.
I can just give you just a couple general highlights. So
sure.
For attendance, we are supposed to be taking attendance for every class, which is different from the spring. Now, we need to get to a point where we start thinking creatively about what attendance could be. Maybe it's, some of the teachers in the group will know, maybe it's that a kid has to do an exit ticket to prove that they were in that class, and maybe they could do that in the evening when they view the class. You know, we have to get creative, but we will have to do that. We have to ensure that our staff is conducting each one of the classes. So we have to take like staff attendance as well. We have to do grading. Grading was different in the spring. It was more flexible. It was a pass-fail. Now grading, we are told, is supposed to be the same as it would be in person. So that adds a different layer of accountability that we did not have in the spring.
Allison,
So
you just said an exit ticket. I feel like that's a very specific thing that in your mind means something. Could you just clarify what you mean by that?
So it's just would be something like if you participated in the entire class, you would have some question at the end of class. Marin, send me a text or send me an email tonight and tell me one thing that you took away from this meeting today that would prove to me that you were in the meeting, even if you had your picture screen off. So, you know, that would be a way that I would know that you were there. Now that could count possibly as attendance, because even if, Marin, we recorded this and you looked at it 4 hours from now, you could then still send me an email saying, this is what I got out of that. So that's like an easy example of it, an exit ticket.
Thank you.
Yeah.
Yeah.
Any other questions?
I have my marching orders for what I need to do for tomorrow. So I think I And if people have other things they want to let
Um,
me know, I'll try and fit it in.
Allison, was there anything else that we're required to do by the state as of right now?
No,
Other than those 3 things you just mentioned? Okay.
no.
So I think that I just want to recapture one little piece too. I mean, so to clarify, as I said before, what we need to decide tomorrow night is what we start September 14th.
Yep.
I think what would be also helpful though is, you know, the discussion about, well, all of us have pretty much named in some different way the sort of concept of a phased program, and having some more flesh onto that, those structures of steps, I think would be an important part of coming out of tomorrow. Again, not necessarily saying, okay, remote is 6 weeks, you know, hybrid full day is the next 6 weeks, you know, nothing, it doesn't have to be that rigid, but I think some degree of laying out a timeline through the fall into the, you know, maybe to get us to November, to Thanksgiving or something like that, break would be helpful for us to wrap our brain around and sort of set some structures like that. And then again, also completely recognizing that that is entirely a concept based on nothing other than what we are saying in this moment and the information we have this moment, and then it's going to have to then be flexible and change based on the metrics, as Dr. Leclerc mentioned, and we've all mentioned as well, tying it to state or regional metrics to be able to then decide, well, we're now, you know, 2 weeks into a remote program and we realize that, yep, we can go into the thing we've already planned, or no way, we've got to scrap that. The metrics have gotten worse. We've got to continue to just be in the remote program or whatever. So I think those are some of the things that I would like to see us get through tomorrow.
Definitely, I'm with you.
I'm good. Does anybody have any more ideas you want to throw on the table? I think we have a lot to think about.
Absolutely. Thank you to all of my colleagues who put such great effort into your ideas today. I really appreciate that. And of course, to Dr. Leclerc and the rest of the staff out there for all of your work. It's much appreciated.
And I
also throw out.
would like to hear from the community.
Whoops,
I'm sorry.
that's okay.
I plugged in and now I'm getting lag. But I truly would like to hear from the community their thoughts about these learning centers, because it does take a village. Thank you all.
Tomorrow.
I just want to throw thanks out to Nellie in particular, but also the union members who were able to turn around their survey in a quick order. We worked with them on, I guess it was it just Friday morning, to be able to put that together and then sent it out. So thank you to everybody, all the teachers, and Nellie for helping put that together and getting us that information by early noon today, so that we could have those numbers and be a part of today's conversation.
Jonathan, anything else? We're good. I agree. I think the community involvement has been incredible. The teacher involvement's been incredible. I know, Allison, your team has worked really hard. These are really horrible decisions that have to be, every decision that you make one way, you have to take into effect that it's going to impact somebody else. So nothing's easy. If this was easy, we would have done it a long time ago. So if we don't need anything else, I think we're ready.
I'll move we adjourn.
We have a second?
I'll second that.
Right. And Lori?
Laurie Garcia, buenas noches.
Merritt?
Marion Goldstein, aye.
I believe Melissa has gone, Marissa has gone. And Jonathan?
Jonathan Schmidt, aye.
Shannon?
Shannon Dunham, aye.
And I think the mayor had to leave. So it's just Cynthia Kwasinski, aye. So this meeting is adjourned, and we will see you all tomorrow for great decision making.
Absolutely. See you tomorrow.
Thank you.
Thank you. Good night.
Bye.